Stomach cancer definition, causes, symptoms and treatment. Can nausea, vomiting, and stomach discomfort be symptoms of stomach cancer? They can. But they can also be symptoms of a bacterial infection. These types of symptoms are called nonspecific symptoms, meaning they are not unique to only one disease but many. Given the ambiguity of symptoms and the almighty power of the Internet, there is unfortunately a lot of space for misinformation, leading to people with actual stomach cancer thinking that they certainly don't have it, thus not seeking help in time. Or, on the other hand, causing real psychological distress to people who don't have cancer by leading them to think that they do. In this video, we will try to fight misinformation by providing you with the only thing we can find on the Internet: accurate and complete information. We believe that an educated patient will have the best chance to seek help on time and be in control of their well-being. This is why we're going to present this topic to you in a systematic and easy-to-understand way. First, we're going to give you a brief overview of the disease, including vulnerable groups and risk factors. Then, we're going to inform you about the early onset and progression of stomach cancer before there are even any symptoms. Next, you're going to hear about the symptoms, diagnostics, and how the cancer staging is done. And finally, we're going to talk about the prognosis and therapy. Now let's start with our overview. Stomach cancer is the most frequent malignancy of this organ, usually affecting people over 50 years old, more often men than women. In the case of early-stage discovery, the prognosis is good. However, every second case is diagnosed in later stages. Stomach cancer is caused by genetic mutations in certain cells of the stomach. These mutations can either be inherited or they can occur during life when they are called acquired. The exact cause of acquired mutations is not completely clear, but it is known that certain dietary habits and pre-existing conditions can promote them. Specifically, high salt and low fiber foods, as well as smoked and grilled foods. This is because smoking and grilling food lead to the formation of certain chemicals called nitrosamines. These chemicals are carcinogens since it is known that they contribute to damaging genetic material in a way that can lead to cancer. Another type of chemical called aflatoxins is also carcinogenic, and they are found in moldy food, for example, moldy cheese. Besides these, nicotine and alcohol are also carcinogens. Of the pre-existing conditions, the most notable one is the infection by Helicobacter pylori. In medical terms, stomach cancer is called gastric adenocarcinoma. Gastric comes from the Latin word gaster, which means stomach. Adenocarcinoma is a compound word derived from the words adeno, which refers to glands, and carcinoma, referring to cancer. This very nomenclature can already hint at the main features of this cancer. That is, it is a malignant tumor originating from the glands of the stomach. Glands in the stomach? Yes, that's right. Let us tell you briefly about them so that you can understand the very origin of stomach cancer. The stomach is a hollow organ of the digestive system, specialized in the accumulation and digestion of food. It receives the food from the esophagus, splashes it with acid, and then forwards it down to the small intestine. The aforementioned acid consists of several chemical elements, all produced by the glands in the stomach wall. The stomach consists of four parts: the cardia, fundus, body, and pylorus. The cardia connects with the esophagus, and the pylorus connects with the small intestine. As you can see in the image, the stomach has two curvatures, greater and lesser. If we zoom into the wall of the stomach, we can see many things, but most importantly, there are three layers: inner, middle, and outer. These are significant for later defining the stage of the cancer. Notice that in the first layer, the mucosa, are the stomach glands, which, as we previously mentioned, is the site of stomach cancer. There are two types of stomach cancer: intestinal and diffuse. Intestinal cancer is usually a single mass that appears on the lesser curvature, or antrum, of the stomach. This type usually infiltrates and thickens the stomach wall. The diffuse type is not so centralized but rather spreads diffusely throughout all parts of the stomach, forming notable masses on the inner lining of the stomach. After a varying time, if untreated, stomach cancer usually spreads in three different ways: directly on the surrounding tissues, via the route of blood vessels, and via the route of lymph vessels. Via direct invasion, the cancer usually spreads to the pancreas, the neighboring part of the large intestine, and the liver. Via the blood route, it most frequently spreads to the liver. Through lymphatic vessels, it spreads to various lymph nodes in the abdomen, but also as far as the ovary and clavicular regions. In the earliest stages, stomach cancer usually produces no symptoms. With the progression of the disease, the first onset of nonspecific symptoms usually occurs. These include discomfort in the upper abdominal region, around the stomach, ranging from a sense of fullness to severe pain, heartburn, dark, tar-colored stool, loss of weight over time, frequently followed by nausea and vomiting that can be bloody. In some cases, a palpable mass in the abdomen. If the disease has spread, palpable masses can be felt in the affected organs. Upon visiting a doctor, a physical examination will be performed first. This is usually followed by an examination by ultrasound, where your doctor will try to visualize the interior of your abdomen, looking for any abnormalities. Crucial diagnostic procedures include gastroscopy and medical imaging. During gastroscopy, a flexible pipe is inserted into the mouth and led to the stomach. The pipe is equipped with a small camera, which allows your doctor to visualize the interior of the stomach. It's also equipped with a small apparatus that can take a sample of the stomach tissue, which is usually done if the doctor notices any suspicious change within the stomach. The purpose of this is to then further examine that tissue and determine whether it is cancer or not. This procedure usually takes 15 to 30 minutes and is done while the patient is sedated to minimize the feeling of discomfort. Gastroscopy is usually complemented by imaging techniques, most frequently CT and contrast radiography. CORD is very helpful in determining whether there are any metastases in the rest of the body, while radiography provides a more focused insight into the rest of the digestive system. In this particular case, radiography is usually conducted with a contrast. Contrast is a substance that the patient consumes orally. On X-rays, this substance is very bright, producing a contrast against the walls of the esophagus, stomach, and intestine. This way, it is easier to notice if there are any abnormalities in the walls of these organs. If the biopsy confirms stomach cancer, the next step is to define which stage the disease is at, as it will affect the choice of treatment. There are 4 stages, graded from G1 to G4, with G1 referring to the earliest stage and G4 the terminal stage. These stages are determined by a more graduated staging scale, often seen in medical documentation, called the TNM scale. In medical documents, patients usually see things like T3N2M1. Let's first clarify what that even means. T refers to the tumor size, and to the lymph nodes in terms of whether they are affected and where and how many, and M refers to the metastasis in terms of whether they exist or not. Here's what knowledge doctors use when assigning these attributes. In terms of tumor size, T1 refers to an early stage. Tumors are present in the mucosa. T2 refers to the tumor, which is also present in the middle, or muscular, layer. T3 refers to the tumor that is also present in the outer layer, or serosa. T4 refers to the tumor that is also present in the adjacent organs. With regards to lymph nodes, N1 refers to 1-2 regional lymph nodes affected. N2 refers to the 2 to 6 regional lymph nodes affected. And N3 refers to 7 or more regional lymph nodes affected. And with regards to metastasis, M0 refers to no metastasis. And M1 refers to metastasis present in other organs. Combining the findings within each criterion enables the final staging of the cancer. Stage 1 is the case with only the inner layer of the stomach infected, T1 or T2, with no lymph nodes affected, N0, nor metastatic deposits found, MO. Stage 2 is the case with the inner and middle stomach layers affected, T1 T3, with regional lymph nodes affected too, N1 N2, but without metastasis, MO. Alternatively, stage 2 cases involve the full thickness of the stomach wall affected, T3, but without spreading to lymph nodes, N0, or other organs, MO. Stage 3 is the case with advanced invasion of the wall, T2 T4, and lymph nodes, N1 N2, but no metastasis, MO. Stage 4 are the cases with partial to full invasion of the stomach wall and adjacent organs, T1 T4, and regional lymph nodes, N1 N2, as well as cases with all three criteria positive: local invasion, T1 T4, regional lymph nodes, N0 N2, and distant metastasis, M1. In oncology, which is a branch of medicine that deals with malignant diseases, the prognoses are usually projected through 5 years of survival after the diagnosis. The prognosis for stomach cancer, as with any other, depends on the stage. When the tumor affects just the stomach wall, the chance of survival is around 90%. With lymph nodes affected, this statistic is around 70%. In stage 3, the survival rates are around 30%, while at stage 4, they are around 5%. Treatment is also defined by the stage, with a general tendency to apply more radical measures for more advanced stages of cancer. The exact therapy is carefully defined on a case-by-case basis through consultation with several medical specialists. So here we will explain just the general guidelines. The gold standard for curing stomach cancer is surgery, meaning complete removal of the tumor. In the early stages, the procedure is minimally invasive, involving just parts of the stomach. With a more advanced stage, a partial or total removal of the stomach and adjacent lymph nodes may be indicated. When the stomach is entirely removed, to make sure that the food can still pass to the small intestine, surgeons will connect the intestine directly with the esophagus. After the operation, patients can be subjected to chemotherapy treatment, which, in some cases, is combined with radiation therapy. Given that stomach cancer is often not so responsive to these types of treatments, they are usually indicated as palliative measures to alleviate the pain and improve the quality of life.